you are finished with your duties, or if you require a change of PPE, then the order in which it is taken off is just as important as putting it on to avoid contamination. First, remove your shoe covers, apron or gown, and outer layer of gloves, goggles or face shield, and lastly your mask. When it is practically difficult to remove your apron or gown before the goggles or visor, then the goggles or visor can be removed first. If your hands become contaminated during glove removal, immediately wash them. Take off your shoe covers and discard them. And unfasten or break the apron or gown ties. Pull the gown away from your chest, touching only the outside of the gown. Make sure the outer gloves come off with the gown. Discard as infectious waste and perform hand hygiene. You should now move out of the contaminated area or patient room into an anteroom. Perform hand hygiene. Remove your goggles or face shield from the back of your head by lifting the bands or earpieces. Place them in a designated container or area for disinfecting. Perform hand hygiene. Next, remove your apron by touching the outside and pulling it away from your body and discard it as infectious waste. Next, remove your gloves by securely grasping the outside of your glove with the opposite gloved hand. Slide your fingers of the ungloved hand under the remaining glove at the wrist, then peel off and discard. Perform hand hygiene. You can now remove your mask. Due to heavy contamination risk on the outside of the mask, great care must be taken when removing them and careful hand hygiene is recommended. Remove it by handling the ties only and discard your surgical mask as infectious waste. In the case of an N95 respirator, you should follow the guidelines for safely storing it. Remove your surgical cap, then perform hand hygiene. Remember that these steps are there for your safety as well as the safety of others.